Welcome to Mount Sinai Live. We stream smart healthcare information that's simple to understand so you can improve your health. I'm physical therapist Dr. Jimmy McKay, and I'm your host. Today, we're looking into what you need to know about cancer research. To help us learn more is Dr. Stephen Itzkowitz, a professor of medicine and oncological sciences and director of the GI Fellowship Program at the Icahn School of Medicine here at Mount Sinai, and fourth-year medical student Parth D. Trivedi. Gentlemen, welcome to Mount Sinai Live. Guys, welcome to the show. Parth, let's start with you. Can you share what your study was published? What was it about in the Journal of Gastroenterology? Talk to us about that.
Yeah, absolutely. Our study was interested in looking specifically at the prevalence of cancerous and precancerous lesions found on colonoscopy among patients under 50. So to date, we don't have much information published at all on precancerous lesions in this patient group. Only really cancers are reported in this age group because that's what's collected by the state agencies. And we have known for some time now that the rate of cancer is going up in this age group, but there isn't great information about exactly how much precancerous lesion prevalence there is in the patient population under 50. Just recently, a task force on colorectal cancer screening changed their recommendation for the screening age from 50 to 45. So we were hoping that by providing these prevalence statistics, we could give clinicians, patients, and other stakeholders some information on what to expect if they were to go to colonoscopy and bolster that recommendation a little bit as well.
Let's dig into that a little bit more. Why is it so important now to be looking at this younger, under 50 age group?
So like I mentioned, the rates of cancer in this age group are going up, and also the mortality in this age group is going up. Right now, we know that the recommendation prior to the age 45 recommendation was at age 50. And still, it's not like people were immediately signing up to get screened for colon cancer at age 50. There's a little bit of an onboarding lag, and we see that that usually happens between age 50 and 55, which is when the gastroenterologist, your primary care physician, wants to get you there. But there is a little bit of sometimes resistance. And so we want to have good messaging here. Once we've changed the recommendation to 45, we want to make sure that patients know why we're doing this. We want to make sure that physicians have the tools and statistics necessary to explain the importance of this, perhaps even starting before 45, just so that patients are prepared for this information. When they get to 45, they're aware that this is what's important and that we're seeing these increased rates.
Dr. Itzkowitz, let's talk a little bit about risk factors. What are the risk factors people should be aware of for advanced premalignant lesions in colorectal cancer?
Well, risk factors for colon cancer in general are things like having a family history of colon cancer or a past personal history of polyps, having a genetic predisposition. Maybe you're born with a particular gene that predisposes you to colon cancer. But the vast majority of people that develop colon cancer and advanced precancerous lesions don't really have that much family history, or they don't have a personal history of polyps. So seemingly, these lesions kind of come out of the blue. We know from population studies that if you look at populations where smoking rates are high, alcohol use is high, ingestion of diets that are rich in red meat and fats and low in fruits and vegetables, and also in sedentary populations, those groups are at higher risk of developing colon cancer and polyps. But even people that follow healthy lifestyles, healthy diet, they exercise, they are still at risk of getting colon cancer and polyps. So everybody really needs to get screened for colon cancer. And since March is Colon Cancer Awareness Month, we're really pushing, in particular this month, for everybody to get screened.
Let's talk about something that I feel like it affects me. It's something called the procrastination effect. What is it, and how can we work around this as we try to detect cancer among younger patients?
Yeah, well, we've known about this for some time, even though for a couple of decades, we've been encouraging people over age 50 to come in for colonoscopy or colon cancer screening. People procrastinate. And in fact, we really don't see the rates of colon cancers going down until people are around 55 or older. In fact, many studies have shown that between 50 and 54, the rates of colon cancer are still going up, even though people were supposed to come in at age 50 for their screening. So with this procrastination effect, we're lowering the age now to 45, and our data shows that we find significant pathology in people 45 to 49. So now our messaging is physicians and patients need to have the conversation about screening before even age 45. For argument's sake, you should start talking to your doctor at age 40 so that by the time you reach 45, you're ready to do the testing.
Yeah. Parth, we'll wrap with you, fourth-year medical student. I know this is a difficult question to answer, but even if you have to repeat some things we've already talked about here, if someone were to ask, how can people prevent colorectal cancer? What were some of the recommendations and the advice that you'd give?
I think the number one recommendation here is go get screened when it's age appropriate for you. And for most people, that's going to be 45 and up, given the new recommendations and what we know about these increasing rates. And for some people, it might be different based on their family history, like Dr. Itzkowitz had mentioned. So that's a discussion that you should have with your physician if you know that there is a history of colorectal cancer in your family. In addition to that, I know Dr. Itzkowitz mentioned some factors like sedentary lifestyle and perhaps diet being related to colorectal cancer. And just with regards to those, those are it's always good to exercise. It's always good to eat healthy. And I think we're still doing more research in that space and trying to exactly hone in on what factors may be causing this increased rate. But as we learn more, again, I underscore screening is the best way to know if you have either a precancerous lesion or cancer itself.
Excellent. Gentlemen, thanks so much for the insight. Find us at Mount Sinai NYC on all major social platforms. This has been another Mount Sinai Live broadcast. We stream smart healthcare information that's simple to understand so you can improve your health. I'm physical therapist Dr. Trivedi. Thanks for watching.